8-year-old Emma had always been Daddy's little girl. She would run to greet him at the door every evening, climb onto his lap for bedtime stories, and beg him to push her higher on the playground swings. But something had changed dramatically. Over the past month, Emma now cowered whenever her father approached, refused his hugs, and would hide behind her mother whenever he entered the room. The transformation was so sudden and severe that it left the entire family confused and heartbroken. Maria Rodriguez first noticed the change when Emma stopped asking for her usual Saturday morning pancakes that she and her father Carlos would make together instead. Emma would stay in her room until Carlos left for his weekend errands. When Maria asked what was wrong, Emma would just shake her head and say she didn't feel good. The 80-year-old who once chatted constantly had become withdrawn and anxious, especially around her father. Carlos was devastated by his daughter's sudden rejection. He racked his brain trying to remember if he had said or done something to upset her, but nothing came to mind. He tried giving her space, thinking maybe she was going through a normal childhood phase. But Emma's behavior only became more extreme. She would physically shake when he tried to talk to her and would sometimes run to her room crying if he got too close. The situation escalated when Emma began complaining of severe stomach pains. She would curl up in a ball, clutching her abdomen and crying that it hurt so badly she couldn't move. Maria initially thought it might be growing pains or perhaps something she ate. But the episodes were becoming more frequent and more intense. What worried Maria most was that these painful episodes seemed to coincide with times when Carlos was around. After Emma collapsed at school during lunch, doubled over in agony, the school nurse called an ambulance. At the hospital, doctors ran basic tests but couldn't find anything obviously wrong. Emma's blood work was normal, her temperature was fine, and she had no signs of appendicitis or other common childhood ailments. The emergency room physician suggested it might be stress-related and recommended they follow up with their family pediatrician. Dr. Jennifer Walsh had been Emma's pediatrician since birth and knew the little girl well. She was shocked to see how dramatically Emma's demeanor had changed. The bubbly, confident child she remembered was now timid and fearful. What struck Dr. Walsh as particularly odd was Emma's specific reaction to her father's presence. The child was fine with her mother, fine with the doctor, and even fine with male nurses. But the moment Carlos entered the room, Emma would become visibly distressed. During the appointment, Dr. Walsh noticed Emma kept touching her stomach and complaining that it felt funny inside. The child described a sensation like something was moving around in her belly, which she said scared her, especially when her daddy was nearby. Dr. Walsh found this description unusual for a typical stomachache and decided to conduct a more thorough examination. When Dr. Walsh began palpating Emma's abdomen, she immediately noticed something concerning. There was a distinct mass in the lower right quadrant that felt firm and seemed to be causing Emma significant discomfort. The child winced and pulled away every time the doctor's hands approached that area. Dr. Walsh's experience told her this wasn't a typical childhood complaint, and she knew they needed to investigate further. The doctor explained to Maria and Carlos that she wanted to perform an ultrasound to get a better look at what might be causing Emma's symptoms. She assured them it was a painless procedure that would help determine if there was anything abnormal in Emma's abdominal cavity. Carlos offered to leave the room if it would make Emma more comfortable, but Dr. Walsh decided it would be better to have both parents present for support. As Dr. Walsh prepared the ultrasound machine, Emma began crying and begging her parents not to let the doctor touch her stomach. She kept saying that something bad was going to happen and that she didn't want anyone to see inside her belly. Maria held Emma's hand while Carlos stood at a distance, trying not to upset his daughter further while still being present for whatever they might discover. The moment Dr. Walsh placed the ultrasound probe on Emma's abdomen and the image appeared on the screen, her face went completely pale. What she saw defied all logic and medical explanation. There, clearly visible in the 80-year-old's abdominal cavity, was what appeared to be a fully formed fetus. Dr. Walsh had to steady herself against the examination table as she tried to process what she was seeing. In her 20 years of pediatric medicine, she had never encountered anything like this. The ultrasound showed a well-developed fetal structure, complete with visible limbs, a head, and what appeared to be a beating heart. The mass that Dr. Walsh had felt during the physical examination was indeed a fetus, but how this was possible in an 8-year-old child was beyond medical comprehension. Emma was far too young for pregnancy, and the family had no history of any unusual medical conditions that might explain this phenomenon. Dr. Walsh quickly turned off the ultrasound machine and asked Maria and Carlos to step outside with her, leaving Emma with a nurse. In the hallway, she struggled to find the words to explain what she had discovered. She told the panicked parents that they had found something highly unusual, and that they needed to contact specialists immediately. She couldn't bring herself to tell them exactly what she had seen until she had more information and could consult with colleagues. The doctor immediately called Dr. Robert Kim, a specialist in pediatric surgery and rare medical conditions at the Children's Hospital downtown. When she described what she had observed on the ultrasound, Dr. Kim was initially skeptical, but Dr. Walsh's reputation and years of experience convinced him to see Emma immediately. He cleared his schedule and asked them to bring Emma to his office within the hour. During the drive to the specialist's office, Emma seemed to sense the tension and anxiety radiating from her parents. She kept asking if she was going to die and if the doctors were going to hurt her. Maria tried to reassure her daughter while fighting back her own tears, not knowing what to expect or how to explain something she didn't understand herself. Carlos drove in stunned silence, his mind racing with possibilities, none of which made sense. Dr. Kim conducted his own ultrasound examination, and his reaction was similar to Dr. Walsh's. The image on the screen showed what appeared to be a parasitic twin, a rare condition where one twin absorbs the other during early fetal development, but the absorbed twin continues to grow inside the host. This condition, known as fetus in fetu, occurs in approximately 1 in 500,000 births and usually presents in infancy, not in an 8-year-old child. The parasitic twin was positioned in such a way that it was pressing against Emma's internal organs, causing the pain and discomfort she had been experiencing. Dr. Kim explained that the condition was not life-threatening in the immediate sense, but the growing mass would eventually cause serious complications if not surgically removed. He scheduled Emma for emergency surgery the following morning. The revelation of Emma's condition suddenly made sense of her strange behavior around her father. Children often have intuitive feelings about their bodies that they can't articulate, and Emma had somehow associated her father's presence with the uncomfortable sensations she was experiencing. Perhaps his deeper voice caused vibrations that disturbed the mass, or maybe his larger physical presence somehow triggered her body's awareness of the foreign growth inside her. The night before surgery, Emma finally allowed her father to hold her again, as Dr. Kim had explained the condition to her in simple terms, telling her that she had a sleeping baby inside her that needed to be removed so she could feel better. Emma began to understand that her daddy wasn't the cause of her pain. The family spent the evening together, reading stories and trying to prepare for what would happen the next day. The surgery lasted for hours, during which Dr. Kim and his team carefully removed the parasitic twin. The mass was indeed a partially formed fetus, complete with developing organs and limbs. It had been growing slowly inside Emma for years, likely since her own birth, but had only recently become large enough to cause noticeable symptoms. The surgical team was amazed by the complexity and development of the parasitic twin, taking detailed photographs for medical journals. Emma's recovery was remarkable. Within days of the surgery, she was back to her old self, running to greet her father at the door and asking for their traditional Saturday morning pancakes. The fear and anxiety that had plagued her for weeks completely disappeared once the source of her discomfort was removed. The family was overwhelmed with relief and gratitude that such a rare condition had been discovered and treated successfully. Dr. Kim later published Emma's case in a prestigious medical journal, as it was one of the oldest presentations of fetus in fetu on record. The case became a teaching tool for medical students and residents, illustrating how rare conditions can present in unexpected ways and at unusual times. Emma's story helped other doctors recognize similar symptoms in future patients. The experience brought the Rodriguez family closer together and gave them a new appreciation for the complexity of the human body and the importance of trusting parental instincts when something seems wrong with a child. Emma kept a small scar from her surgery, which she proudly showed to friends as proof of her adventure and the time she had a sleeping baby inside her belly. Years later, Emma would become a pre-med student, inspired by the doctors who saved her life and helped her family understand her mysterious condition. She often spoke about her experience to encourage other children facing medical procedures, telling them that sometimes the scariest situations can have the most wonderful outcomes. Her story became a testament to the importance of thorough medical investigation and the amazing resilience of children in the face of the unknown.